everyone, it's Angela from Nutmeg Consulting. We are doing a little chat today with my friend Jennifer.
Hello.
From Trilogy Physiotherapy. No, what is it really called?
It is Trilogy
Physiotherapy. There you go. It's when you tag it on Facebook, it gives you 2 locations. So you're at the Prince Edward one when I visit you.
Yes.
There's another location as well.
A downtown location.
Awesome. Yep. So we are going to talk today about pelvic floor physiotherapy and pelvic floor health. So I feel like that's a buzzword right now. I'm sure it's not a buzzword to you, it's your job. But a lot of people are finally figuring out that this is an important thing. So how about we start from the basics? What the heck is pelvic floor physiotherapy and pelvic floor health?
Pelvic floor physiotherapy is basically, this is what your pelvic floor looks like. And what is your pelvic floor? Your pelvic floor is a series of muscles that runs from your pubic bone all the way to your tailbone. And during pregnancy, we do tend to put a lot of pressure with the weight of the baby on the actual pelvic floor and our muscles. So the pelvic floor is there to help hold up all your muscles in your pelvic organs, such as your bladder and your uterus. And it helps to support all of those organs. And during pregnancy, we add a lot of extra pressure to that. Oh, yeah. And during birth, we do end up with some putting some pressure as well with giving birth vaginally. So pelvic floor physio is, what a pelvic floor physio does is we assess your pelvic floor, your internal pelvic floor. So it requires me to do a vaginal assessment and a rectal assessment to take a look at what the pelvic floor state is. Mm-hmm. So we do that prenatal and as well as postpartum, usually at the 6-week marker. We tend to do...
Or the 3-year marker, like me.
Exactly.
And I had never... So to me, pelvic floor physiotherapy, now I hear that, in Europe, everyone goes for at least 6 sessions or more, I think. After they've had a baby, it's very common. Of course, you go for physiotherapy after you've had a baby.
It's actually...
heal and...
Yeah, it's standard of care in Europe.
Where here... I was in this business for almost 20 years and had never heard of it until 2 or 3 years ago. And someone said, well, once you're postpartum, you're always postpartum. So my 3rd kid, he was already 3 when I met Jen. And I always thought that it was just, it's like a joke. Oh, if you pee yourself when you're laughing or when you sneeze, you pee yourself a little bit after you've had a baby. I didn't have that. So I thought I was fine. And by the way, if that is a thing, that's not normal. You don't need to just have that forever. She can fix that.
It's common. It's common, but not normal.
Yeah, it's not normal. So it's not just a thing you have to live with. And so I guess, that was interesting to me. It's not just that as a symptom. What other things after you've had a baby would make someone know, it could be really helpful to go to a pelvic floor physiotherapist?
Well, similarly, before I had children, I never thought I needed pelvic floor physio because I had a C-section. And then I had another C-section. And then all of a sudden, I started having these urge to go to the bathroom all the time. And I felt like if I didn't go to the bathroom, I was going to pee my pants.
Yeah.
And sometimes it did happen. So it's called urge incontinence. And so a friend of mine said, well, why don't you go see a pelvic floor physio? I'm like, I don't need a pelvic floor physio.
I'm a physiotherapist.
I didn't have a vaginal birth. I had a C-section. And so I ended up going to see a pelvic floor physio, and it was because my C-section was too tight. My scar was very bound down. It was causing my pelvic floor to be tight and creating an urge incontinence for me. So it was amazing. And I said, this is awesome. We need to get more and more women out there going to pelvic floor after they have had childbirth. So after you've healed for 6 weeks, then we do an internal exam. We take a look at what the state of your pelvic floor is. And people say, oh, don't worry, just do your Kegels, that should be fine. But this is actually not true, because we have to determine, is your pelvic floor weak or is it tight? And in my case, my pelvic floor was really tight, causing me to have urgency.
Yeah, that's true. People think, well, if you're tight, then everything's must be fine. And I actually had a cesarean for my 3rd baby, and when I came to you, you checked my scar. I didn't even know that was a thing that you could do. And for me, it wasn't any, peeing. Everything had been fine, but it was something like heavy feeling when I would walk for a really long time. It didn't feel like anything was going to fall out, but it did feel kind of like, I don't know, just not normal. So, and I didn't know that's what I I thought maybe that's how I was going to be from now on. And I had a little bit of a separation.
Yeah.
So that's
something
the
else.
diastasis everyone talks about now too. People are learning about that.
Diastasis or mummy tummy, but it is very important to deal with that right away. It's your connective tissue, and everybody thinks, oh, my abs have separated, but it's actually not that. It's your connective tissue has stretched. And it's supposed to stretch. That is actually a normal part of pregnancy.
Okay, yeah.
So what we need to do is we need to create that proximity again into that connective tissue, and we need to create a good tension so that you don't end up with low back pain. You don't end up with prolapse down the road because your pelvic floor and your container isn't tight and it's putting a lot of weight down on your pelvic floor. So we do teach you those exercises. We give you proper tips on how to get up from the floor and what exercises not to do after giving birth and what's a safe way to start exercising as well. So it's a whole variety of things that we take a look at. So not only just an internal pelvic floor exam with what your pelvic floor state of your pelvic floor is, we look at the container. We also look at, in my profession, I started off with orthopedics. So we look at what is your pelvis? How is it aligned? Are you sitting in that nice tucked under bum position from pregnancy?
Yeah. Actually, that's so during pregnancy for sure, like people don't know, you can go before you have the baby to know ahead of time what to do. I would have loved that.
Yeah. And would have been good. Yeah, and we can help you, with in prenatally, we can look at your posture and help with giving you more tips with stance and how to keep a good sort of postural during your whole pregnancy. So, the forward head, rounded shoulders, bum tucked under because belly's growing forward. That all promotes some poor posture even into our pelvic floor.
Cool.
Yeah.
You have a pelvis.
I have a pelvis.
Show us.
So this is what our pelvic floor looks like. This is so you can see it goes right from the tailbone all the way to the tailbone. From your pubic bone all the way to your tailbone. So your pelvic floor it's again holding up our uterus.
It's our uterus before our baby gets in there.
And our bladder. And also our rectum. So we talk a lot about, as well as pelvic floor physios, we talk a lot about constipation. And, when we take those nice prenatal vitamins, sometimes that can lead to constipation. But we need to learn to make sure that we have our proper amount of fiber, because if we're always pushing on the toilet as well, then we can create a lot of pressure down on our pelvic floor. So that's a big topic of conversation as well. So the pelvic floor is an encompass of a whole bunch of muscles and ligaments and tendons, and so we work on that, and we give the appropriate exercises. And depending on, again, if your pelvic floor is tight, then we look at lengthening, and we look at reverse Kegling, or if it's weakened, then we start working on Kegling and getting your pelvic floor functioning again to hold up those pelvic organs.
Cool.
And I think the other thing that's important to know is that, you might, people always say, and I talk to my friends about it, and, I feel good. I don't feel like I have any issues. I feel like it's important that you need to see a pelvic physio at least once. Look at what's going on, because where we find it that we're having issues down the road, and this is where France has really shown that they're having less issues as women going through menopause. And as we go into menopause, things change again, and our estrogen decreases, our tissue tension is less. So then our pelvic floor tends to drop, and then we're seeing more issues with prolapse and in uterus or bladder, and it becomes more of an issue, and it's better to deal with it before that happens.
When we have time to keep it good and solid in there. Yeah, absolutely. Well, that's so awesome. Thank you. We were just chatting earlier saying we might have to do a little series of these videos to teach different things. So we hope that we'll do that again, maybe once a month even.
That'd be great.
And we'll check back in with you, and we'll give you time to get questions ready. And so, I'm going to post in the links how you can find Jen at Trilogy Physiotherapy, and you go visit her.